Hi, this is Dr. Baez from the Wellness Institute of Neurodevelopment. Today, I want to talk to you about a topic that I'm frequently asked about, and it's what are the best supplements for brain health? Well, first of all, the most important supplement that I always prescribe as an initial treatment it's multivitamins. Multivitamins have the vitamins and minerals that your body needs in general. And they're crucial for your body because they're the keys that turn on the engines. We cannot obtain all the necessary vitamins and minerals just from our diet because we usually are picky eaters or because of mass production of food takes away the nutrients from the food and we ingest more toxins than nutrients. So the second most important thing that you have to take into consideration when you are choosing a multivitamin, it's absorption. How your body it's going to absorb that multivitamin. If it's a tiny tablet and it has a lot of vitamins, your body is not going to absorb it. So it's not worth it taking it. So what you're going to look for is multivitamins that talk about absorption. Because if a company produces a multivitamin that has good bioavailability and good absorption, that's good for you because your body is going to absorb it and you're going to have enough vitamins in your body to be able to function or to make those reactions that your body needs happened. The second supplement that I think it's very, very important, it's omega-3s. And why omega-3s? Omega-3s used to be in our diet. And actually, if you eat fish at least twice a week, oily fish, or use olive oil in your diet, you might be able to get enough omega-3s. But most of us don't. And why is omega-3 important? Because myelin, that is what surrounds the neurons, it's made of omega-3. And this helps in neuron connections. Also, omega, it's good for your heart. It lowers cholesterol, it decreases triglycerides, and also helps with inflammation. This is very important. Omega helps with inflammation and it helps with fatty liver. It's also been reported that it helps you with weight loss and it can decrease your waist size. And in addition to this, there's tons of study that associated it or it can has been found to help with diagnosis like depression, ADHD. It helps concentration. It helps in attention. So very important to know that omega has there's three types of omega. There's DHA, there's EPA, and this ALA. DHA helps with brain function. EPA is the one that reduces inflammation. So you want a supplement that has both. And you want to avoid the other types of omegas, 6 and 9. If you have too much of 6 and 9, you're going to increase inflammation instead of decrease it. So you should avoid vegetable oil or fried food where refined vegetable oils are used. What I recommend as a dose is 2,000 milligrams per day for adults. In children, it's going to depend on the weight. The last thing I want to mention is omega-3 should be stopped 2 weeks before surgery. And the reason is because it can affect coagulation during surgery. So that's what I want to summarize about omega-3s. There's a lot of more information, but I just want you to have a little capsule of the most important things. The next supplement I want to talk about is vitamin B12. Vitamin B12 is the most important vitamin for the brain, but it is very hard for the body to absorb it. Only 35% it's absorbed through the gut. So commonly people have deficiency. In addition to that, now that I'm doing genetic testing, I'm finding, I would say like 90%, 95% of my patients have vitamin B12 deficiency. And this can affect how the body metabolizes vitamin B12 and makes it available in its active form so the body can use it. And this is going to affect in multiple ways. First of all, vitamin B12 is very important for energy production in your body, for detoxification, for production of neurotransmitters, for bone health. It also helps with red blood cells, the blood vessels, and it helps you have more energy. It prevents dementia. It helps with attention. It helps with detoxification. The most common form of vitamin B12, or the way that the body absorbs it, it's through eating red meat. But a lot of people don't eat enough red meat, or red meat has other side effects like having too much fat. So conditions, for example, where vitamin B12 deficiency is seen more often, it's in older adults, when the person has gastrointestinal disorders like Crohn's or celiac disease, when they have had gastrointestinal surgeries, bariatric surgery, or resection of the intestines. Very important, and this is something that I want to uh, be very strong about. Vegetarian or vegan diet. I see patients with vegan diet with very severe vitamin B12 deficiency, and they don't know it. I recently had a young adult that actually had problems walking, and it was related to vegan diet and not having enough vitamin B12. People that take blood sugar control medications, or heartburn medication like metformin, proton pump inhibitors, are also at risk of vitamin B12 deficiency. So how do we supplement this beside diet? Well, first of all, if you take it orally, most of the vitamin B12 that you take orally, you're not going to be able to absorb. So the best way of taking it is sublingual. And you can take a dose between 2,500 and 5,000 micrograms a day. But the best way that I supplement it, it's injectable or by IV, because I'm giving the active form. But for that, you need a prescription, so it's harder to get. So you can have a good supplementation with sublingual vitamin B12. The third, the fourth vitamin that I want to recommend for you to supplement is vitamin D. And it's very important if you're inside, especially now with the quarantine, that we supplement vitamin D, because it has been associated with mental retardation. Vitamin D is very important for the immune system. And now that we're trying to fight COVID, it's very important we have adequate levels of vitamin D. Obviously, everybody knows that vitamin D is very important for bone formation. And it's very important for the brain. It can cause muscle weakness, pain, tiredness, depression. Usually people that have vitamin D deficiency have high blood pressure, have diabetes, have problems with infections, immune system disorders, cancers like colon, prostate, breast cancer, multiple sclerosis. So I see it very frequently in the practice. I always check a vitamin D level. But one way that you can get vitamin D and assure that you're getting some, it's exposing yourself to the sun for 15 to 20 minutes, 3 times a week. Supplementation, it's going to depend on the person. I have a wide range of doses that I have to use for different people, but a good start is 400 units to 1,000 international units a day. So I usually check levels because of the variety of supplementation I have to give to my patients, and also because too much vitamin D, it's dangerous. You don't want to take too much. So if you're taking vitamin D, you need to ask your doctor to check levels every 3 months. I want levels between 65 and 80. It's what I recommend. The last supplement that I always prescribe, it's glutathione. Glutathione is the most potent antioxidant there is. And the reason why I prescribe it is because 99% of my patients have problems with detoxification. And detoxification problems, it's associated with conditions like Alzheimer's, dementias, problems with genetic mutations. And this is something I see now that I'm doing genetic testing very, very commonly. genetic mutations that not allow you to detoxify well. Probably the detoxification also puts you at risk of cancers. So it's very important that glutathione is included in this short list of supplements. Usually by mouth is not good because it's degraded by the acids of the stomach. So you have to look for a formulation that actually talks about how it's protected from the acids of the stomach. Usually they open up in the duodenum and they talked about it. Nowadays, in the most common form that I use, it's without prescription because the strongest form that I use is prescribed and I use it in an injectable form, nebulized form. But for over-the-counter use, the most effective one that I have seen is liposomal sublingual formulations. They have the studies of bioavailability. Remember that name. It's how much your body's going to absorb it. And the studies show good levels in the bloodstream. So glutathione is one of those key ingredients that is going to help you with energy production, but also the most important thing, detoxification. Well, I hope this short video has helped you to find out the most important supplements for your brain. If you have any questions, please don't hesitate to write to us. Our email is info@wellneuro.com, WELLNEURO.com. Our website is wellneuro.com. And thank you for listening to us today. This is Dr. Franceschi from the Wellness Institute of Neurodevelopment.